Greetings to all of our lovely Patreon supporters. Thank you, as always, for all of your support. You're making this channel possible. This is our exclusive little podcast for you this week in our new digs, which hopefully won't be around for much longer. We'll get back in the regular bunker very soon. But I've got a little news item that I'd like to discuss with both of you regarding the NHS, the wonderful National Health Service that we have over here in Britain, which is free at the point of need, is the philosophy of the NHS.
Yeah, so it comes out of taxes, but everyone can use it if you need it. That's
exactly.
what you're saying.
Exactly, it's
Free
completely
healthcare.
Yeah, basically free healthcare. Yeah, free healthcare for everybody. There's a bit of breaking news today, very controversial, that four pharmaceutical firms have been accused of colluding to restrict the supply of a drug to the NHS and driving the price up 700%.
Nasty business.
This stuff makes me
nasty
angry.
business. Yeah.
Yep.
What's the drug?
The drug is called
What does it do?
Unobtainium.
prochlorperazine, which is an anti-nausea tablet.
Okay.
It's just anti-nausea. And the price rose from £6.49 a pack to £51.68 for a
Wow.
packet.
Wow. That's mad.
Because
Yeah.
the suppliers, there were four companies, one of them called Alliance that makes the drug. They're kind of outsourcer called Focus. So Alliance makes the drug and then they give it to this company called Focus, who then supply it to the NHS. And two other companies called Lexon and Medreich, announced a few years ago that they were going to create their own alternative drug to compete with them in the market. And then Alliance and Focus decided, instead of competing with those two other companies, they would just share the profits with them.
Yeah. Is that not illegal? That seems illegal to
Yeah.
me.
It sounds pretty illegal, doesn't it?
Because it's kind of manipulating the market.
The weird thing is that the companies are all just saying, we didn't do anything wrong. But they're literally paying two other companies to not compete with them.
It's
Yep.
is not like what's the word? An oligopoly.
Nice word.
Yeah, that's a
Fancy
good
word. Is it not? But is it not that kind of thing where they control the whole market share? So the idea, like you're not supposed to, what's the word? Align with each other. You're supposed to be competing.
Yeah.
Yeah. That seems very not right. I'm not sure if it's illegal over here. Maybe it's illegal in America, but
Well, so far, what that's been said is that the Competition and Markets Authority, who are investigating it, well, I think they've investigated and they've accused them of it, say that if they're found guilty, they can impose a financial penalty of up to 10% of each company's worldwide turnover.
From
turnover as well.
that particular year.
Yeah. So that's huge.
Yeah, that is.
That's a potentially huge fine.
Yeah.
Which, to be honest, I'm glad they can apply that.
Yeah.
Up to
It's good.
10%.
It should-
Up to 10% though.
It's probably going to be
It's probably gonna be-
0.5%.
yeah.
Yeah.
At the same time, as you say, I mean, if they're able, it has to be something like that to put people off.
Yeah,
Yeah.
Otherwise,
definitely.
it won't.
Yeah.
Because there was that most hated man in the world, wasn't there? I can't remember his name.
Yeah.
Shkreli.
Shkreli.
Yeah.
And Andy Shkreli.
Yeah.
or
You
something?
just pumped. Was it cancer drugs? Wasn't it?
Yeah.
Yeah.
It was the big pharma in America.
Yeah.
He was doing this exact same thing, basically.
It's interesting because this drug, although it's an anti-nausea drug, but it's chiefly used for chemotherapy patients. So cancer is the connecting tissue here,
Yeah.
for lack of a.
You probably. I doubt you have. Yeah. Okay.
Hey, yeah.
I doubt you have much information on
Yeah.
this in particular, but surely there are other anti-nausea drugs that the NHS can just use instead and go, screw you, you've lost all your orders, and they'll get
Well, you may-
screwed
yeah,
over
sure, doesn't it?
financially. Like,
Yeah.
as in, they're obviously doing this to profit massively. They only have to sell less than or just over a tenth of the drugs to get the same amount of money through. So if you stop supply altogether, surely there'd be.
Yeah.
It's a big problem. The NHS has been facing this increasingly just in the last decade, because the amount that the NHS is spending on drugs is increasing on average 5% per year. 5% per year when the NHS budget is increasing 1.5% per year.
Yeah.
So the price of drugs is vastly outstripping the money they're being given by the government, by taxpayers, to provide the healthcare.
So what's the answer to this? What do you combat that with? Because that's
Mm.
I only see this becoming an increasing problem, not even
Yeah.
just with drugs, but also like machines that are privately made and used by the NHS. Because it seems, I mean, that is a huge problem in the NHS, isn't it? Like,
Yeah.
kind of semi-privatization parts of it that can charge extortionate amounts because the NHS has to buy from them, kind of thing. I guess with drugs and that kind of.
What do they call it? I can't remember. It's gone now. But yeah, it's. I think Gordon Brown started it with Tony Blair in the noughties. So in the last 15 years or so, the NHS has been increasingly contracting out services, but particularly machines like CAT scanners or stuff like that, to private companies, and then kind of outsourcing patients even to private hospitals and private surgeries. Under this government system, this government scheme. And it's just causing huge problems because they're spending a fortune on private healthcare.
I mean, practically the whole of dentistry is that as well.
Yeah.
Anytime you're on the NHS with dentistry, it's pretty much always a private clinic that has NHS patients and other patients.
I don't know, are there any actual NHS clinics around for dentists? I thought they were
all private, but on the NHS.
I thought they just,
I don't think so.
Yeah, just not anymore. They used to do.
Yeah, it's an interesting problem. I mean, you know, going out there, could they just cut out the middleman and make the drug themselves? Set up, you know, I'm just spitballing here.
I mean, another thing that I remember when I was growing up, I assumed this is how it worked. Obviously, I was very naive when I was growing up, but I thought the NHS could basically buy drugs, had the power to buy drugs from any company at their own price.
Yeah,
I thought that they had that power. It just made sense in my mind that they should be able to say, we will pay you £3 for a packet of drugs because that's how much it costs you to make them. But of course, the private industry, Pharma, Big Pharma, then responds, and they've got an argument here where they say we need to profit from the sales of our drugs, especially to big clients like NHS, because we spend so much in development. But then it's kind of a vicious circle that's self-imposed because the NHS actually has a policy. I don't know when this policy was introduced, but it was definitely in place in the 1990s and might have been in place since the beginning of the NHS in 1947. I'm
going to say yes.
I'm going to say yes. And the policy,
sounds about right.
The policy is giving patients immediate access to effective treatments. So in other words, providing the best drugs to patients, incentivizing the pharmaceutical sector to develop new drugs and keep expenses down. And I don't know how on earth you fulfill. It's contradictory, isn't it? Because
that's having your cake and eat it, isn't it?
Private companies aren't going to develop new drugs unless they're going to make a profit.
No, exactly. And they need, in a sense, they need to as well.
But it's, I guess, like it would be interesting to take a look at the head of those companies and the like high up executives at those pharmaceutical companies, and just see how much money they make in a year.
They do make
the bonuses and
it's huge. And then just the revenue, and it's sickening as well. And I know it's legal; it has to be legal. But there's basic drugs like paracetamol, which technically no one owns the patent because they've been around so long, but they're still able to charge a fortune. We have it quite cheap over here, but when you actually look at the cost of producing them, but these things have been around for the better part of a century or more, and no one legally owns a patent, but they're able to charge a huge markup, and you're just like, wait a second, how does that?
I mean, it costs about 10p for a pack of 20 over here, but
depends on where you buy it.
I was going to say more like 25p.
Boots okay. Yeah.
More like 25.
They're inexpensive.
Sorry.
I understand what you're talking about there.
Yeah.
Another thing is the NHS have done recently is removing certain drugs that are more expensive in favour of ones that don't necessarily have the exact same effect, but are of similar. Like I know I remember looking at the list of drugs a little while ago that they removed, and they claimed that these drugs were medically not seen as effective, but some of them were just like a different version of the same drug, but was say a drug that was slow release the medicine in your system throughout the day as opposed to all at once. And so it's like ultimately that might be a little bit better for someone, maybe like 5-10% better for their body because it releases it slowly, but it's cost 10 times as much. They're like, nah. So a lot of those kind of drugs have been taken off the market.
It's caused some huge problems. There was one thing that I do know about because it affected my family was the heart drugs. They had for people with chronic heart conditions, there's a particular drug that the NHS stopped providing because it got too expensive. And the substitutes just didn't exist. It's basically a unique drug, but it was too expensive. And a lot of heart patients more or less died.
Wow.
Years earlier than they would have done if they'd been able to continue taking this drug, but it was just too expensive.
Yeah. Part of it is, even if you find an alternative, it's your body's used to that particular type. I know with certain drugs, even if another one is as effective, you can't just suddenly switch. It's dangerous too.
Yeah.
So that's the thing. Like, even if there was another heart drug, a lot of these patients wouldn't suddenly be able to just be like, okay, well, I'm on this one because it's cheaper. I'd be like, no, you can't do that, even though it has the same effect.
I mean, someone else I know who has a chronic condition, not life-threatening in the typical sense. The NHS stopped buying drugs because they got too expensive, and they said, we can put you on this new course of drugs. And they said, are they as good as the drugs you're giving me? And they said, the consultant said, like, no, not really. So they just said, okay, well, I just won't take any drugs then. And actually, they've been fine.
Okay.
I mean, obviously they could be better, but they've been fine.
Yeah.
And it's been some years now. It's just, and that's the point we're getting to.
That's worrying.
Yeah.
So, I mean, the thing is, like, the NHS is presumably one of the biggest customers of these private companies.
If I'm correct, I think the biggest pharmaceutical company in Britain is GlaxoSmithKline, and I'm pretty sure their biggest customer, like over 50% of their revenue, I think, comes from the NHS.
It's got to be.
But surely
Something
that would put the NHS in a lot of power as well.
Yeah, you'd think.
You would think anyway. Like, if they've decided, we're going to mark it up 700%, like the NHS, I would have thought, could just turn around and say, no, we're not paying that.
I mean, the issue
we'll pay you this, and take it or leave it kind of thing.
I mean, why I asked about this particular drug is the fact that a lot of these drugs, the ones they do mark up massively, are ones that people, if they can't get them on the NHS or for whatever reason, they'll still want to get them because they are the best drugs or the only drugs for their particular condition. So it's not like, okay, well, the NHS is in a good position to bargain. If the NHS isn't bargaining, the people who are on the NHS will probably try and find these drugs anyway, or because even if they drop their number of customers in half, if you marked it up by 10x, then then you're still making more money.
I guess
there's definitely certain. I don't know if you agree with. I think there's certain fields of life where profiteering just doesn't apply in the same way. For example, Apple might be the only people who provide. Or who provided the iPhone at some point before other companies came up with their own versions. But at that point, it's a choice whether you have that smartphone or not.
Yeah.
When it comes to medical treatments, you can say, well, we're the only people who can provide this, so you'll pay the price that we set for it. It's not the same thing.
Yeah, exactly. It's like it's life and death. It should be.
It's your quality of life. But on a physical basic level is affected by whether or not you can take medicine. The quality of life on an entertainment level with a smartphone is purely your choice. So that's where profiteering is kind of allowed because you can always go for the cheaper version. But when it comes to drugs, I think, sure, they have to make a profit, but it has to be controlled, I think.
Well, that's some people's argument against private healthcare, especially in the US, isn't it? It's the fact that some people just genuinely don't have the decision whether they have insurance, and then they get in trouble, then they can't get the healthcare because they just don't have the money.
Yeah.
And so it's like,
I mean, it's mad in the US. Like, I mean, apparently I've heard that they pay more per person on healthcare, but they don't have the NHS or free healthcare. But the government's still shelling out more per person for healthcare than we do over here.
Yeah, and not everyone has coverage. Yeah. It's mad.
Which seems mad. Yeah, I don't know where that money's going.
Pretty sure it's just
into private healthcare.
I always find it quite funny. But there's a few examples of people that have come over from other countries to live in the UK, and they're like, "Oh no, I'm going private." And then they go into a private clinic, and I get it. In some areas, like in the NHS, you do not get seen immediately. Like you do have to wait for an appointment. But at the same time, they've seen the same doctor, and in fact, there've been cases where things have been missed, and then they've only gone back to the NHS or emergency thing because that's available and it's been on the NHS, and they've actually picked up on something quite serious. A couple of examples I know of that.
Wow.
So it's just pretty mad that isn't all you always get the best service, or at least you get the same service.
Yeah, definitely. Like with my family, like quite recently, they were offered a choice of like private healthcare, but they were like, the doctor basically said, in all honesty though, the one at the NHS offers has a better machine. So you probably want to use that one. So like, fine, yeah. So
that's crazy.
Yeah.
There's another aspect to this that I wanted to just mention briefly, is that this is an ongoing and growing crisis in the NHS, that drugs, the prices of drugs are escalating, and therefore the budget of the NHS is being stretched. But particularly it's shifted. It used to be that GP surgeries, which is the first kind of layer of protection, where if you have a minor problem, you go to see a GP before you go to a hospital where you have a serious problem. But it shifted. That used to be that the biggest expenses on drugs were from the GPs, but now it's hospitals.
Okay,
interesting.
And the reason they think that is because according to NHS's own studies, in the last decade in particular, well, last 2 decades, massive increase in the age of the population, the average age of the population, loads and loads of pressure on hospitals because of serious conditions that elderly people are suffering.
Yeah.
So getting taken to hospital in an ambulance as opposed to going to the GP.
Or going to the GP and being referred immediately to the hospital because the seriousness of their problem can't be solved by the GP and the drugs that the GP can prescribe. So my immediate thought was, and I wonder what you thought about this, is this growing problem. Imagine a housing market where the prices go up and up and up and up, and it's because of a certain generation. Do you think that generation might expire in the next couple of decades, and then the problem will be reversed? And by which point, if that happens, has the damage already been done?
Oh no, I think that's a problem that will only get worse.
Oh,
right? Yeah, the aging population are going to be ongoing. They're not just going to die and then.
Right, I mean, there are the baby boomers, aren't there, who are now getting older.
Yeah.
And there is a big.
That's the generation that, in particular, is using hospitals a lot right now.
Yeah. As I say.
Yeah.
Even like.
Yeah. It's interesting though. Maybe. Do you reckon some of that as well is down to the fact that, like, if you want a GP appointment, I don't know about you guys, but it takes me about like a month to get an appointment.
It takes ages.
So if there is a serious problem, generally people will just go into a walk-in center.
Yeah, that's quite good. Yeah.
With my one, I don't know if you guys have something similar, but it's on the day you can get an appointment, but it's like you phone up at like 8:00 and it's like,
they've got this.
You phone up and they go, yes, there's an appointment. And they say, it's at 2 or at 1 or at 10 or whatever, and it's just like, yeah, cool, I'll accept that. Unless it's something like serious, or if there aren't any appointments, then you can phone back at like midday or whatever, and they go, okay, well, maybe there might be one freed up in the afternoon or whatever. So you can get them on the day, but it's a bit of a lottery, unless it's something serious, and then they do see you, or if it's to do with children or whatever, then they tend to make an exception.
No, you're right. Mine does the same thing. It's funny, isn't it? Because you're right, Alex. Over here, it's impossible to get an appointment if you're trying to book in advance because they're just booked up forever.
Yeah.
But then, like Martin says, on the day, because what happens is a lot of people don't turn up to their appointments. So on the day, they'll be like, yeah, we've had a last minute cancellation, so you can come in today. But I've had that actually, where I called up to book for the day after because I was able to do it, and they said, "Oh, you can come in today." I was like, well, "I'm physically nowhere near you, so I can't come in."
The other thing is, it's like, I'm sure with a lot of people when they're going to work or whatever, they'll be like, you can't just phone up and say, "Oh, actually, I'm off today because I've got an appointment."
Maybe. Depending on the lottery.
Yeah, exactly. And so if you have to, say if you have to leave the house at 7, the phone at 8, like you can't just bank on that being available. So why not be?
A lot of doctors' surgeries have another problem over here in Britain, in that there's the amount of paperwork and processing that the doctors have to do instead of treating patients has increased so much in the last 10 years that a lot of surgeries effectively are closed in the afternoon, and they only see patients in the morning, which obviously massively reduces the number of patients that they can schedule to see.
Yeah.
Yep.
Is that whole like everyone has their own GP and their own doctor that they see, which has its benefits, obviously. Like the doctor knows who they are, but I find it mad that like you can't just You have to re-register with a new GP if you move somewhere.
Yeah.
It should all just be centralized, I think. And
the digitization of the NHS has been a long, slow, painful process.
There was, although if I phone up, or when I phoned up, it's been like, well, your GP, like I very rarely see the GP who's my GP.
Yeah.
But then, I don't want to go into a medical thing, but I have to go to other places for stuff anyway. So I hardly ever see the GP because it's like they don't really know what's going on.
Yeah, and I've moved around so much as well. Maybe it'll change as we get older, but I've moved so many times and registered at so many different surgeries. There's no GP that I can call my own.
But like, even talking of like resources, I mean, I had like a pretty major operation a couple of years ago. You guys know about.
And the breast's looking good.
Thanks, mate. And but for that, which was pretty significant, it was like 5 days, and then I was out of hospital. Which is
that's fast.
Yeah. Like a few years ago, you wouldn't have been in for 5 days. Like, well, you've recovered really well. It's like, no, you just don't have enough beds.
Yeah.
So it is becoming an issue.
But also, if there's no option for public healthcare and it's all private, then you get what it is in America, which is far more expensive.
That's the thing. Yeah, the
huge inequalities.
Yeah.
One of the flaws in capitalism as it's developed is the competition thing doesn't really work the way, I think in some sectors. In some sectors, it seems to work okay. Competition keeps everything in check, but it doesn't in other sectors.
Yeah, when there's very few companies manufacturing a drug and the drug is patented anyway, then you can't really have competition, and they can do these things where they manipulate the market to be 700% what it's worth.
That's crazy, yeah.
Mad.
Well, please let us know your thoughts in the Patreon comments below or on the YouTube comments. And again, thank you for all of your support. And we'll see you next time.
See you later.
Bye-bye.